Hi everyone, today here I'm with a new topic, that is infection control for nurses. As we know that what are the infection control strategies to prevent the spread of the infections. But in NCLEX, when the questions are asked, it's so tricky that we get confused what is the correct answer. So here are some of information which can be helpful for you to prepare. So let us know what is infection control. So infection control are the measures that are taken to prevent the spread of infection from the harmful microorganisms in the healthcare settings. So the key aim is to prevent the healthcare associated infections, to protect the patient and the healthcare professionals, to implement safe practices in the daily care. There are different types of pathogens that can bacteria, viruses, fungi, and mycoplasma. Mode of transmissions, as we know, there are different modes of transmission for the spread of the infection. It can be direct transmission, indirect, airborne, droplet, and vector. So let us know what is direct contamination. Direct contamination is from person to person, either through the touch it can happen. Indirect transmission, it's through the contact with the contaminated surfaces. Airborne pathogens, when it is suspended in the air and when the person is exposed, they can have the infection. Example is TB. Droplet is through the pathogens. When it's in the it can be spread from the droplets, that is through sneezing or through coughing. Example is flu and COVID-19. Vector-borne diseases through insects or animals. Example, malaria. The standard precautions to prevent the spread of infections are, as we all know, hand hygiene is the main thing that we have to do before doing any procedures or after doing the procedures. So wash hands frequently with soap and water or use alcohol-based sanitizer. So I will give you here a tip that if a NCLEX question comes and in that options if it's hand hygiene, so don't think of anything, just put a click on that one only. So the hand hygiene will be your correct answer. Then personal protective equipment, gloves, gown, mask, face shields. Cough etiquette, you have to cover your mouth or nose with a tissue or handkerchief, or you have to use with your elbow to cover the face. Safe injection practices, always use single needles and syringes. Sharp disposal, use puncture resistant containers to dispose of the sharps when you are finished. Transmission-based precautions are for the contact precautions for infections that are spread from direct or indirect contact, such as MRSA or CDF. In that cases, you have to wear gown and gloves. So always remember, glove and gown is for contact precautions. For droplet precautions, for infections that are spread by large droplets, in that cases, you have to wear mask. Example is influenza and pertussis. In airborne precautions, for infections that are spread from airborne particles, example TB, chickenpox, in that scenario you have to wear N95 mask and the patient have to be kept in the negative pressure. Negative pressure room means the organisms that are in that's being exposed in the air, it will go out of the room, it will not remain in the room. There are, apart from this, other precautions also, protective precautions, that is usually for the immunocompromised patients that we are using. Droplet precautions, the mnemonic for this one is, always remember, Spider-Man. So S stands for sepsis, scarlet fever, streptococcal pharyngitis, P is for parvovirus, parvovirus B19 and pertussis pneumonia, I for influenza including H1N1, D diphtheria, E. epiglottis, R. rubella, M. meningitis, mumps, mycoplasma pneumonia, and EN for adenovirus. So remember the mnemonic, that is Spider-Man. Now coming to the airborne precaution, the mnemonic for this one is MTV, that is measles, TB, and varicella, chickenpox, herpes zoster, which is also called shingles. The contact precaution, the mnemonic says MRSV. So M for multi-drug resistant organisms, R for respiratory infections, that is respiratory syncytial virus, S for skin infections, V chips, Uh, W for wound infections. If there is a wound infection, definitely the person has to be kept in contact isolation. Most of the times, these wound infections that are coming, it may be MRSA positive itself. E for enteric infections, if the person is having Clostridium difficile, watery, loose, watery stools, there definitely that person has to be kept on contact precautions. I for eye infections, conjunctivitis. Infection control in practice. So as we know that the most of the strategies we are following in the hospital, first is hand hygiene to prevent the spread of the infection. Use of correct PPEs, always assess the risk of exposure and use these PPEs accordingly. Proper cleaning and disinfection of the surfaces. So always follow the protocols and the policies that are followed in the organization for cleaning of surfaces, equipment and patient areas. Now coming to antibiotic stewardship. So there is a term which you should know for this for any infection related strategies. So the definition for antibiotic stewardship is the careful management of antibiotics to prevent the resistance. As we know that most of the times the antibiotics are the started for the patients, but once the symptoms are subside, they will stop the antibiotics. So it's a resistance. So it will not, the infection will be still there, but the person will be not fully cured. So that for that one, antibiotic stewardship has been created. Nursing regimen is to educate the patients on the importance of completing the prescribed course of antibiotics, monitor for any adverse reactions and for its effectiveness also. Now coming to healthcare associated infection. The common healthcare associated infections are surgical site infections, pneumonia, bloodstream infections. The prevention strategies are for this one are adhere to infection control practices. Prevent catheter associated infection, that is COTI, and surgical infections also. When to perform hand hygiene? As we know, that is a standard procedure that is followed worldwide is before and after the patient contact, before and after procedure, after contact with contaminated items, and after coughing or sneeze. Now, what is the difference between disinfection and sterilization? Disinfection is the process of cleaning that eliminates most pathogens, but not all. So, example is cleaning surface with bleach solution. So, it is just cleaning the surface. It will not eliminate the pathogens that are present in the surface. Sterilization. Definitely, the sterilization it will eliminate all the forms of microbial lice that is that are in the environment, that is in the instruments or in the equipments. So this it will which can be spores also. So autoclaving is done where the it is boiled at a certain temperature and the microorganisms are eliminated. So autoclaving, mostly we are doing the autoclaving of the surgical instruments. So here I want to ask something like when we are cleaning the endoscope equipment. So most of the times what we are using, are we autoclaving or disinfecting? What we are doing in in for the endoscopic instruments, we are putting that one in. Usually what we are putting in Cydex. Okay, what is the other name for Cydex? It is butyraldehyde. Okay, butyraldehyde. The common infection control mistakes that are has to be avoided are failure to perform the hand hygiene. Always be careful. If anyone is not doing the hand hygiene, you have to remind them. Improper use of PP. Most of the times we have seen that people are not wearing the PP. So we have to educate them what is the indication of using these PPs. Inadequate cleaning or disinfection of equipment. So if you are not cleaning the equipments properly and we are using that in the infected equipments to another person, so definitely the infection will spread. Then not adhering to the isolation protocols also. So we have to always follow the isolation protocols. If a person is having a patient is on contact isolation and we are not wearing the gown and gloves and we are attending another patient, what will happen? The infection will definitely spread to that person also who is not having any chance of having infection. Or for immunocompromised patients, if you are attending, it can happen. It can lead to infection in that person. So here are some quiz practices for you. Which of the following is a key method to prevent the healthcare associated infection? So What is the key strategy? You have to, the options are wearing gloves only when necessary, frequent hand hygiene, not cleaning surfaces, and using antibiotic excessively. So what I told previously, if there is an option coming like this, hand hygiene is there, definitely you have to click on hand hygiene only. Now, second one, which of the following infection require airborne precautions? Influenza, tuberculosis, Clostridium difficile, and MRSA. So, which infection required airborne? Tuberculosis. So, influenza, you will put patient on droplet isolation. Clostridium, you will put the patient on contact. And for MRSA also, you will put the patient on contact isolation. Now, the third one is which type of personal protective equipment should be used for droplet precautions. So, for droplet precautions, what we are using? Surgical mask, not N95, no gloves. We will use the gloves. Goggles. There is no sense of using goggles here for this infections. Goggles are only for if there is a spread or means splashes can infect us. In that scenarios, we will wear goggles. Thank you. Now, a patient is with MRSA in a wound, which type of precautions will be needed? Contact precautions. Definitely, the MRSA, we studied that MRSA, we remember that mnemonic. In that case, we have to use contact precautions for the patient.